My father was an oncologist, and so I grew up hearing a lot of stories from him about what he was living with his patients, and they really piqued my attention. For me, it's one of the best specialties that I could have found because it joins the science and the excitement of new therapies along with a really special relationship you get with your patients. You grow very close and you get very personal with your patients, and that's something that I really enjoyed in medicine. Immunotherapy is in the forefront of all this research, and it's extremely exciting to see that we're sometimes able to stimulate our immune system in a way that it can actually fight cancer, which is really what it was meant to do all along. But it's really fascinating when you see it happen. I was actually the head of a clinical trial at Moffitt when I was a fellow and then a junior attending on using vaccines to fight low-grade lymphoma. And so I think it's just the way that they've been able to trigger the immune system. Clearly on a molecular level, there's been huge advances to understand how cancer operates. I think it's still extremely complex, and that's why there's no silver bullet to cure all cancers, but there's much better understanding. So certain types of cancers can be treated much more effectively. A lot of friends and family tell me how it must be so difficult and so hard and depressing, and for me it's actually quite the opposite. It really fills me to be able to talk with my patients throughout the day. There's something special getting in that room and then closing the door and being alone with your patient and being able to talk about very personal things. And I also share a lot of my personal life with them, and I enjoy that. For me, it's a really very nice experience, and I'm very grateful that my patients open up. And I think there's not many spaces where you can do that, where it's a protected environment, where you can trust the person and just talk about your worries.